the basic format of this, I really want this to be as interactive as possible. I know you've got tons to ask them, but first we want to hear from them. And we'll open up with a general question of, we want to get to know them a little bit better other than what you've read in their bios, particularly how their work, each of their respective streams of work, feeds into the SDGs or how the SDGs feed into their work. We've already heard from Bob on this, but of course I'll give him a chance to say one or two more things. I'll start from the farthest left with Rita. Rita, just a few things to say about your work and the interrelation of the SDGs and where you see that particularly situated in Africa's growth. Yeah.
Sure. So, can you hear me? Oh, okay, excellent. So good morning, everybody, and thank you, Melba. I'll kind of start at a high level in terms of GE healthcare and then trickle down a little bit into Africa and what we're doing here. So in early last year, 2016, GE Healthcare's operations in Africa, ASEAN, South Asia, and India came together to form a business that we call Sustainable Healthcare Solutions. And essentially, it's bringing these regions together that we believe have similar challenges and realities when it comes to healthcare, and therefore relying and leveraging on each other to kind of develop innovations and solutions based on those shared experiences. The mission: to bring access to affordable and quality healthcare to the estimated 5.8 billion people on this planet with limited or no access to healthcare. And how are we doing that? It's a five-pronged approach. One, it's through developing economically relevant technologies designed for those settings, not for other settings, and bringing them over. The second piece of that is through financing, so innovative financing models to be able to finance these innovations and for our clients as well. The third piece of that is through business model innovation. No longer business as usual, trying to figure out how can we do things differently to solve these challenges that continue to persist. The fourth piece of that is through capacity building and training of healthcare workers. And then last but not least, which has been a key theme around here, is partnerships. Again, acknowledging none of us can do this alone. It's the old adage, right? If you want to go fast, go alone. If you want to go far, go together. And so leveraging on the core competencies of each other to be able to achieve impact that each of us on our own wouldn't be able to do. And at that global level, then it trickles down onto the African continent through what we're calling our primary and referral care initiative. Again, how do we re-engineer primary care on the continent? We know the challenges, we can speak, and we've spoken about them ad nauseum, but beginning to see how then do we provide access to that level of, within the continent, to be able to, again, allow access, affordability, and quality, and as a result, impact on SDG 3, healthy lives and well-being for all. And partnerships, SDG 17.
Thank you so much for that wonderful introduction. I'll now move to you, Rolf. Perhaps you can, again, introduce yourself, talk about your introduction. I'll go to you and then I'll come to you.
Okay. Can you hear me? Yes. Good morning, everybody. Philips, I think, is a household name for many of the kind of things, but if we talk about innovation, we talk about also how a company is changing from where they were, where they are right now. So Philips is well known for many products, but have actually sold many of the businesses and reinvested them into healthcare. And that's why we are right now. We are a healthcare company. And that is from 2016 a very important statement over here as well. If we look at innovations and solutions which are needed for the emerging markets, African context, it's important to think differently. Because who are actually our clients? The clients in where they really matter, in the case for Africa, for example, the accessibility to people who are needing it most, they were not our customers. We didn't know them. So it's important to really understand the customer first of all, so we had to go down to the community. And for that, we also had to bring up an innovation hub, that's what we created over here in Kenya, to really be separate from the normal business. So an innovation hub itself with scientists, young scientists, by the way, all below 35 years, to really understand the need of the community, to develop solutions, products, business solutions, finance solutions kind of things for Africa. Working together in a partnership with our research hubs in India, but also Europe as well, whereby we bring all these things together. It's important to bring that separately from the normal business, because in that innovation hub, you can make mistakes. Like Bob says, you need to make mistakes, go on and make others, to make sure that you can do this kind of things continuously. So, do we have products for those areas where they really need it? Yes, we can talk about ultrasound, but we develop these kind of things. The challenge is here to develop products and solutions which are not currently here yet. Yeah, so, for example, we had a call from UNICEF. Can you design a device which is needed to diagnose pneumonia? Because we all know that about 100 million or 1 million children are dying from pneumonia every year, which are preventable, very easy treatable as well. So how can we define solutions over here? So we defined in this innovation hub a device which is tested and finally scaled up for the total emerging market, not only Africa, but total market as well, Asia, India, etc. as well. So for us, it's important to bring local relevant solutions in Africa, together with Africans, making sure that we also partner with the solutions to scale it up, because we can pilot many things. But I think, well, like Bob said as well, we need to make sure that they scale up, otherwise they are not relevant. Yeah, we need to really make sure that they scale up. So we work together, for example, with Grand Challenges Canada. We work together with other partners as well to really make sure that that scaling up becomes a reality and does not stay into the pilot environment.
Thank you. Thank you, Nicole.
I actually wanted to connect with a comment that you made earlier about Kenya being such a young population. And in fact, I think one of the most exciting things about living here now since a year is that it has a very cool vibe, and I loved the techies that were just on stage and seeing them work and developing solutions. And yet, when we sit in a meeting room like this and the many conferences that are held across Africa, we often try to bring solutions that were developed in Europe and the United States in the 1950s when my parents were growing up. And we try to indoctrinate and push them into the market in Africa, and we expect them to work. And actually, being such a young country, what you see is that Kenya and many African countries are leapfrogging with innovative technologies such as M-Pesa, something that I only learned about a while ago, and now I can't even imagine how I could do without it. It also means that you have great systems like Uber that allows you to take a taxi with a strange guy in the middle of the night in Nairobi, that is supposed to be one of the most dangerous places on the planet. If I read all the tour guides, and yet I find it extremely safe.
Yes.
It's not.
And to clarify, it's not her view. She's just saying what they say out there.
I'm just quoting some of the wrong press releases in Europe. But it is actually technologies that has made a great change, right? People walking around with mobile money on their phone has made Kenya a safer place. Uber has allowed me to take a taxi in the middle of the night and actually got home safely in one piece. So as PharmAccess, we realized that it shouldn't be business as usual. We should actually build on those technologies. So taking the example of Uber, imagine you could do the same thing for healthcare, where you would have this little app that would tell you exactly what the quality of the doctor is, what the right route is for your antenatal care and your delivery, and that you get a proper health outcome, and that you actually got value for the amount of services that you paid for. Now, I think that would be a great innovation. The challenge and the difference between healthcare and Uber is that we all understand what a good taxi ride is, right? So we didn't get hit by a matatu and we got home safely. With healthcare, that is more complicated, especially because often those who benefit from healthcare and need healthcare, the people that we're all worried about in this room and talking about, are not the people that are paying for it. There's no such thing as sustainable healthcare at the bottom of the pyramid unless we can get those who can pay and should pay to pay for those that are vulnerable and the poor. And what we're trying to do with technology is exactly that. We're trying to build on a very important social and cultural infrastructure that you already have here in Kenya, through the chamas, through the Harambes, through this culture of sharing and exchanging funds with each other, but being able to target it to healthcare and spend it to those doctors that are committed and dedicated to improving quality of care. And I think then you're reaching out to something completely different and you're allowing Kenya to leapfrog. And we were having a little bit discussion before we started this panel that this discussion, this conference should be about how Kenya and how Africa is leading the world. As PharmAccess, we are committed 3 years from now to take a Dutch delegation here, meet with the Ministry of Health, and show that Kenya has transformed the world, and we'll take it back to Europe. So that's what we're trying to do.
Thank you so much, Nicole. And actually, you've set me up really perfectly for Bob's question, because we had about, Bob gave the address about what Safaricom is doing with respect to the SDGs. And Nicole really feels passionately that Africa needs to lead its own agenda when it comes to delivering on the SDGs and innovation and all those wonderful things that we are discussing here this morning. So, Bob, my question for you then is Africa ready? Are we ready as a continent and as a people to actually invest in innovation and in technology when it comes to healthcare? And perhaps you can speak a little bit more on whether you feel that public-private partnerships are the way to go on this issue.
I think the answer to your question lies behind me. If you look at the people who are sponsoring this, Johnson & Johnson, GSK, Rockefeller, PharmAccess, Philips, the answer is no. Africa is not ready to invest in healthcare. Neither are, let me just be a little bit controversial, but honest, because I'm assuming that's why you asked me to be on the panel. Neither governments, private sector, nor the individual. That's why we have such a low penetration of health insurance. The companies, apart from the obvious companies in the healthcare sector, no one else really wants to do it. We believe that when we're sick, a Harambe will get us out of trouble. And that's the problem, because actually when we're sick, we end up with an economic disaster, having to sell the only assets you have, take kids out of school. So my answer is that I don't believe that Africa as a whole are investing or have the appetite to invest. These young people, it breaks my heart when I look at the brilliance and, to your comment about innovation, I think we are innovating, and these young people are innovating a lot. Whether it's them, whether it's people like Toto Health, but they're not getting the support. They're not getting the support from the private sector like us. And I think we've framed healthcare a little bit too much in the philanthropic charity kind of donor space a bit too much. And companies aren't going to want to get into that space because they say, well, our foundation can only go so far. But actually, if companies look at it through a different lens, and we always say it with the Sustainable Development Goals, if you look at your business through the lens of those goals, you will see that there are opportunities in doing that stuff. And yes, we make some investment with Philips and Huawei and the others in Lamu, but ultimately that will be a commercial solution. It can't just be a charitable solution. So sadly, we really don't value health enough.
Wow, I gotta say, you're really brave to just say no. All of us were expecting yes, resoundingly yes. Am I right? We've got human capital, we've got the youngest population, we're ready to go. Then you paint this realistic picture that actually the private sector isn't really gearing up for this, and most of the investments are from non-African countries. So that's a huge dose of realism to those of us sitting here, and we appreciate the candid views. I'd like to give a chance to anyone in the panelists who wishes to disagree, please disagree.
If you feel brave enough.
Yes, Nicole, thank you. Please.
Two bold comments, and I have Roelof to protect me in case Bob and I get into a fight. I think there's a lot of examples out there of Kenyan companies ready to invest. I mean, we and Bob, I think we're working together with CarePay, that is a Kenyan company that is here, that has Kenyan investment capital, together with foreign investment capital, but Kenyan investment capital, ready to build this technology to drive change in Africa. So is it happening? Yes, I think it's not as bad and as depressing as it may sound, but what we need is much more support, much more innovations, and I guess also much more equity and investment capital that will allow local Kenyan companies that are maybe a little bit higher risk than a big Philips organization, or PharmAccess for that matter, allow them to grow and stimulate.
Interesting. Yes, yes.
As
yes,
well.
please.
It's interesting to see the different perspective over here. I tend to agree, partly also with Bob as well. Is Africa ready? In many ways, with the innovation, with the young guys and kind of things, like you say, yes, there is a lot of innovation kind of things, but at the same time, there's also a lot of fragmentation as well. If we look at how Africa, in many countries, still depending on many donor funds, etc., to keep healthcare sustainable, we should go away from being dependent on donor money. Countries should invest more, have more bold statements, guys, this is what we need to do in healthcare, instead of being dependent on all kind of donor communities from this is what we can do for you, with all fragmented solutions. There are so many donors in the country, and all doing their own things, and sometimes doing the same thing in the same place, yeah, because everybody thinks this is good. Yeah? Let's also channel that money, bring it together, make sure that they invest together into the right programs, so that they actually become independent from donor money.
So that, feel free, yes, sister, clap away. That leads me to your question. And I also want to just give a few thoughts on this issue, whether Africa is ready. I think most Africans are ready. It's just that we just don't know how to go about it. So you've got people sitting in private sector who know that the way to go about investing is X, Y, Z. Kenyans and Africa, we invest in land. If it's not a plot and I can't see it, my friend. So then, the issue then becomes, how does the private sector package what it has or what it wants to enable those of us who've got 1,000 bob only, not millions. But, you know, we're 44 million Kenyans. 1,000 bob can give you a little something. So I think there's a gap there, and that there's a lot that's not known. A lot of us would want to get involved, we just don't even know where to begin. And going to the NSC is not a solution because, my goodness, where do you even start? So my question for you then is, what should be the role of private sector in enhancing these sort of innovations and technology for healthcare or other SDGs in Africa?
Yeah, interesting question, I think, as well. If you look at what Philips is doing, and I think I mentioned before, is to really look for solutions which are relevant for the African market itself. So our investment is geared upon really bringing, in this case, an innovation hub, really with young scientists who have the bright minds, who are working together with IHAB, for example, and NILAB, and etc., to really bring together these bright minds, things, make mistakes, but also work together with all the partners. Yeah? But then with the goal to make a sustainable solutions, not the goal to pilot. The goal is actually for us as well, and we want to invest as a company, but at the same time we also have to mitigate as risks at the same time. So we need to make sure that this balance is there. And we need to make sure that both are investing. And I think the government needs to come on board to really invest heavily in where it really matters. In this case, we feel primary healthcare is really a topic where they have to invest much more. Especially also in Kenya, but many other countries as well. We are talking to the government to really making sure that the investment on primary healthcare is important and needs to be much higher on agenda right now. There is a lot of investment, but if you look at the Abuja agenda, how much of GDP are they investing? It's still a tiny bit of actually what they're doing. Yeah, so the role of the private sector, in our case, is really bring solutions together, foster partnership, create the ecosystem together as well, to have this bold dialogues and difficult discussions as well, but also make it forward, yeah.
In terms of the use and function, we're looking and need to be promoting technologies that we can use to shift care upstream. So in terms of early screening and early detection, whether it's about antenatal screening to, again, assess risk early. We talked about the dual burden of disease on the continent right now. So it's early detection of cardiovascular disease, of cancers. And then also linked to that, we need to promote technologies that offer some element of clinical decision support, right? So if we're able to detect early, what does the healthcare worker need to do? So easy protocols that are easy to guide the healthcare worker in making that critical keep or refer decision. What does that next step look like? What does a case management need to be once you've been able to identify what's going on? And then also technologies that support provider education, some of what has been talked about here, provide assistance for kind of second opinion or assistance in diagnosing, so kind of telemedicine and things like that. And then last but not least, they need to be technologies that still promote outcomes, because that's what's most important, right? It's not innovation for the sake of innovation, but we need to make sure that even though they are designed for our settings, that quality is never compromised and they still deliver the same kind of clinical outcomes that we're looking for. And that's kind of to Nicole's other point in terms of reverse innovation. If we take them from here and move them to the West, they would function and produce just the same kind of results.
Could you share your experience as maybe PharmAccess on other appropriate models that would work apart from a sort of government support or, or value-added services, maybe from your experience as PharmAccess? Thank you.
Always need government support for healthcare financing, but the most important role for the government is to protect the really vulnerable poor, the indigents, those who no one can take care of. And yet when you look at a lot of the programs, because it's so difficult to target people, you sort of spread out HIV/AIDS treatment or free maternity, and everybody's entitled to it, and yet most of us sitting in this room will hopefully have a good insurance cover from the company or the organization that we work for. So it's actually very strange because it creates inefficiency in how you do healthcare financing. So I really consider technology and something that we're developing as well, not only to help you with clinical decision making processes, which is of course very important, but it should also be a trust enabler. The fact that with technology you can reach directly to those people and you can identify those people, send them text messages, send them vouchers for free maternity, but you target those for those people who need it, whereas the people who do not need it because they are supported by a company or they are supported by a family, you create much more in the efficiency in the healthcare system. And I think that is something that we'd like to target. Right now, if you want to give money, you want to support someone, you give money to an organization or you give money to the government, but you don't really know what happened to it until you read the annual report 2 years later, and the data is at best a good guesstimate of what was going on. I think technology can really create this individual transaction between people willing to pay, supporting those who cannot pay, and as a result, because you use technology, you can really reduce transactions fees. So if you look at your typical voucher program or insurance program, the overhead costs can be anywhere between 30 and 60% of the cost of such a program. Not because people are just grabbing it, although there could be some more efficient systems, but also because you have all these different layers and you need to reach out to the people, and the claims have to go back to the hospitals, and the hospital needs to be paid. The moment you do that with digital transaction, you reduce your transaction costs to just 1%, 2%, something like that. This has been the success of M-Pesa, right? All of a sudden it became so much more cheaper and so much more affordable than just going to a bank, especially when it's only small amounts. And yet I'm sure Bob will agree that it meets a social purpose, but I'm sure it also meets a financial purpose.
Absolutely.
And I think if we can do that same thing, lower transaction costs, create efficiencies, I think you'll find there's actually a great business model behind it, where at the end of the day, everyone benefits.
Sam Gichuru is the CEO and founder of NILAB, and NILAB is our partner that helped us actually implement our hackathon. This is our first hackathon. And I'm going to ask Sam to just... No, Sam, you're not here to sit down. You're here to work. Yeah. Good morning.
Hey, how you doing?
So I asked Sam to come up here because we have two sets of groups. We've got two runner-ups. I mean, this is how good it was. And we had 3 finalists. So I'm going to ask Sam to just say 1 or 2 words on the runner-ups, and please, we'd like to invite them to the stage to receive certificates. Just so that you know, the 2 runner-ups were selected by a panel of judges following, and they'll receive acceleration support for their idea by NILABs, and that's why I've asked Sam to come on board. And Sam, maybe you can just invite them, and let's see if they can get their certificate for their award, and congratulations to the winners. Here they are.
Good morning. I'm already panicked. I just got here. But great to see you, Philip. How you doing? Well, we had a very interesting session. This program has been running for about, I think, 2 months now. So people came for boot camps where we trained them how to build solutions. The first boot camp, the second boot camp, and the final one was a hackathon. Now, what happens in a hackathon? It's 48 hours. You come in the morning and you kesha, if most of you remember what a kesha is. You remember what a kesha is from high school. With your laptops, work with groups of experts. AMREF was able to bring in doctors, midwives, mothers. We're able to consult. You bring in the techpreneurs and these people, and they work together. And within those 48 hours, you're supposed to build something that we can actually see. So it's a lot of pressure. No sleeping. Well, there are a few sleeping bags around. You have showers. We had a gym. At the end of that process, you present the solutions to judges. And then the judges decide what's good. So we ended up with, we were supposed to pick 3 solutions, but we ended up with 5. And we had a long argument. We could not agree which to pick out of the 5 to be 3. So we decided we're going to pick all 5 of them. It's the high conference. Come on, you should clap for the judges. Some of the judges were very adamant about it, like we're not leaving these 2 behind. The others said we have to do this. So we'd like to call the runners up, Afia Plan. So Afia Plan is building a health solution that is building a fintech health solution where they put together groups of women who are pregnant in chamas or merry-go-round, and they save towards making sure that they can pay for their pregnancy when it comes to term. So at the end of the pregnancy, they can actually pay for the bill using an app. So think of it as fintech for pregnant women in the sense of merry-go-round. Doppler, the one that they use that's very manual. They've actually automated it and put a microphone in it, and it's able to record the data to a small screen where you can actually see what's happening. And they're also able to back up that data to the cloud. So those are the 2 runners-up.
AMREF is actually going to also support them to scale up their innovation and to bring it to market. So really, AMREF is taking the lead in this, and we're hoping that in the next hackathon we have additional support and partners. And welcome, Jerome. Maybe you can share with us the 3. We'd like to invite them, and yeah, these are our 3 winners.
Thank you very much.
Yep.
All right, thank you for inviting me up on stage. I would like to thank Desta, Dr. Gridinji, from NILAB, Sam, Annie, and Josephine. Without all of you, this hackathon would not have taken place. So let's give a round of applause to the 5 of them. I'll keep this short. Sam has mentioned all the details about how innovative. We've received a total of 117 applications, and we've picked the top 15. So for the judges to vet through to pick the top 15, that was not easy. And on the behalf of Takeda, it's my honor to be working with MREF, to be working with NILAB, to help improve the access to medicine to all these innovative solutions and improve the quality of critical health services. So without further ado, in no particular order, I would like to first invite Chandra Plus up on stage. All right, this team is from Kenya. Right. All right, the second team, all the way from Uganda, Wakabere. And for the last team, before I call them up, I really appreciate them coming in down to Kenya because the event started on Tuesday and Wednesday, and they've only arrived on Tuesday 3 a.m. in the morning and started to attend the hackathon as early as 9. So they only had 6 hours to refresh themselves and start to build the solutions. Amazing. From the team from Nigeria, help mom.